Hello everyone and welcome to Biohackers Lab. I'm your host Gary Kerwin, and on today's show I have got Dr. Ann Childers. Dr. Ann Childers is a psychiatrist with a special interest in helping all ages, from children to adults, to regain physical and mental health through nutrition, sleep and psychiatric care. She has published in textbooks and is an international speaker. Thanks, Ann, for coming on to the show today.
Oh, it's my pleasure. Hi, everybody.
Hi. So, Ann, I think let's get the first question over with. I know you want to address it. People might ask, if they're watching the YouTube video, why have you got a slight shake in your head?
I know. I've actually had people come up to me, like when I was on the low-carb cruise, that were so worried about me because they had a friend or a relative with Parkinson's, and they were very worried that perhaps I had contracted that. I do have a neurological condition, but it's not something that causes trouble except for a little inconvenience. It's called dystonia. It's something that I inherited. So comes and goes.
And you've had it for a long time.
Perhaps it'll be gone next year. I hope so.
Okay, good. So yeah, if anyone's watching and they're worried about Dr. Ann, she's good.
Yep, good to go.
Good, brilliant. So you've been one of my low carb, high fat, or as Dr. Gary Fettke would tell me, call it healthy fat experts, for many, many years since you were at the low carb convention in Cape Town. So as a psychiatrist, I love to maybe find out, why would a psychiatrist be interested in nutrition?
Well, I think nutrition and sleep are basically the foundations from which every psychiatrist should work, but we're not well trained in it. So when I came down with illness about, I would say maybe in the early 2000s, I really had to figure it out for myself. And as my health improved, so did my psychiatric condition, which was attention deficit hyperactivity disorder. So I was really impressed by that and thought, gee, if it works for me, why wouldn't it work for my patients? So I spent almost every year after that studying fairly intensely, trying to gather as much as I could about the subject of mental health and nutrition.
Okay, so yeah, from your own personal experience, and treat it as, I guess, happens so often in healthcare, where something happens to you, which gives you an even deeper interest, and you biohack yourself, you fix yourself.
Yeah. I think that's it. And in medical school, they told us common things happen commonly.
Yeah, I remember that.
So I thought, well, I can't be the only person, right?
Mm-hmm.
I can't be the only one. Yeah.
So I'm interested. So if you said in the year 2000, then was this only when your ADHD symptoms first cropped up, or you had always had them and you only got to really address it then?
I'd always had them. I was the 7-year-old who was told by the teacher that she would have to sit in the corner behind the curtain. And from behind the curtain, I just kept jabbering. I was the one that was always in trouble. But I didn't know why. And I was so easily distracted. I would go from one thing to another thing to another thing. And it was very hard for me to study in high school. In fact, I used to do all-nighters, or I'd get up at 4 a.m, and I'd try to keep my mind on it. But if there was no motivation for me to study, I wouldn't do it. It was if I had to get enough adrenaline going to be able to study. And basically, adrenaline is internal Ritalin.
Okay.
It's very much like that. It sort of acts as a stimulant. So I get myself practically into panic mode. And I actually did all-nighters in medical school, which is, I think that is the definition of insanity, really. Because you can't get everything that you should have been studying for the last 3 weeks in one night. It doesn't work.
Yeah.
And and I nearly failed neurology, although I got a near honors on my second try. They gave me a second try. But that didn't seem to teach me a lesson. And it wasn't until I actually tried a stimulant that I could remember a full hour of lecture. And at that point, I was already a fellow. And I just sat in my office and cried, because I felt like my education had been lost, that there was so much that I didn't remember. I feel better now because since that time, I've spent so many hours studying and trying to catch up. I feel good about it now, and I can concentrate better now, although I'm by no means perfect. I'm still not the most focused crayon in the box. But I have enough technology around me to support me. And I have my niece who's really wonderful at the front desk. So I do fairly well, but, and I would say also my diet has made a tremendous difference. It's not 100%, but I would say it's at least 60%. And that's fantastic.
Yeah. So if we get a little bit more into your diet then and the nutrition aspect, what was the biggest change from a dietary point of view to help your own brain, your own neurology to calm down, to give you that focus in the ADHD situation?
I think there are things that I quit that really helped. And one was grains, and the other was I was putting maybe a quarter of a cup of powdered skim milk in my coffee every day, trying to give myself what I thought was low-fat protein. And eventually it got to the point where I felt drugged every time I did that. I would feel so drugged that I couldn't drive.
Wow. So having the stimulant of the coffee, but with the skim powdered milk, was actually causing further problems for you.
Trouble.
Yeah.
Yeah. And so I quit that powdered milk. This was at a point where I had a woman come to organize my cupboards. She would actually label every one of my cupboards so that I would know to put the dishes in the same place twice. Wow. That's how disabled I was. I was totally confused. And I stopped the powdered milk after one morning when I said, "You're going to have to drive me to the Container Store to help me get something to organize because I can't drive. I feel really confused right now." I felt drugged. And so I stopped that. I started doing more real fats. And then one day when I was in a meeting with other healthcare providers, I realized that I wasn't keeping up with the conversation, and I hadn't had that experience for a while. And it turned out that just before the meeting, I had eaten some little yogurt peanuts that had powdered milk in them.
Wow. Okay.
And I immediately got very confused and started asking questions that had already been answered. It was embarrassing because I felt like I was disrespecting the people around me by not listening to what they had to say, but I couldn't keep up cognitively. And that was a big eye-opener for me. That's when I said, food does make a difference. And there are probably other people out there that are eating things that don't agree with them, and they're having a hard time concentrating. And if they just got rid of those things, they'd feel better. So what I did was, I may never know all the things that gave me trouble, but I did get rid of all of the powdered foods and the processed foods. And that made a really big difference for me. Like I said, maybe 60% difference.
Yeah, so just getting rid of processed and going to eat real foods. And I think your story there is incredible too, just to say how one processed food, like what someone might think is healthy as yogurt-covered nuts, actually created massive neurological stress on your system. So if you want to be performing at top level, like in your case, just eating something you think is healthy, but it's a processed healthy is actually detrimental.
Yes, and one of the chief ingredients in that was powdered milk.
Yeah. Okay, so I can see why you've got such a keen interest in nutrition. And so how do you now implement this as a part of your practice? Because you are a practicing psychiatrist still. So I'd be interested to see, can a patient who might come to you change their diet to improve their cognition, the psychiatry? Yeah.
Absolutely, yes. I first do a series of tests, and the vast majority of the healthcare plans do allow me to do certain labs. And these labs include things like B12 and folate, homocysteine. This is a way of checking the methylation system part of the methylation system of the liver. And also to see how well they are processing meat, fish, eggs, poultry to get their B12. So they may have stomach problems, etc. Iron, very, very important. A lot of kids, especially teenagers and women of reproductive age, are iron deficient, and they look as if they have attention deficit disorder combined with depression. It's very hard for them to function. It's very hard for them to concentrate. And it turns out that in large part, it's because they don't eat red meat. They've been cautioned against red meat. They think it's bad for them. And so now they don't have heme iron as a good source of iron, especially women who have heavy periods. And also athletic men. A lot of athletic men are low on iron and they don't know it. And this can also impair their concentration and make their mood much lower than it should be. So those are among the tests that I do. I do also vitamin D, and I do several others as well. So anyway, once I get these, then I have some idea of how the nutritional status is for my new patients. And from there, I can basically make some recommendations about supplements to support them. The other thing I do is I ask them, well, what's a typical breakfast? What's a typical lunch? And I usually find out that these people are getting flooded with refined carbohydrates, which I sometimes refer to as acellular carbohydrates, because these are the kind of carbohydrates that are not coming directly from the plant, like a potato or some other plant source that has cell walls. It's actually so powdered that the cell walls are gone. The cell walls that surround the cells of plants are absolutely gone. And so this would be things like flour and sugar. These things digest extremely quickly and turn to glucose in the bloodstream. So I want to know about that because if I can get them on more of a whole foods diet and less on a processed foods diet, they do better. By and large, they do better. It's pretty stunning how well they do. And then sleep, of course, is very important. I know our talk is going to be mostly about diet, but I also ask about their sleep habits, their sleep patterns, because that can also change their metabolism if they're not careful.
Well, yeah, I mean, I know sleep itself is a massive topic, but I would be interested if we could just touch a little bit on that, because I know I read it all the time in articles that typically in the US where you are, that a lot of people are severely sleep deprived, where they try cram in only 6 hours of sleep so that they can work 2 jobs, 3 jobs, whatever it happens to be. And so from a psychiatric point of view, I know it's a spectrum as to what the perfect amount of sleep is, but how would you even address to sorting someone's sleep out, so that, because they have to sleep to heal their brain too?
They do. And I won't say that I can't catch every type of sleep disorder, but I am a member of the American Academy of Sleep Medicine. And although I'm not board certified in sleep medicine or even close, I know enough to know when I need to refer someone. And it's been a really wonderful capability, because I simply ask some questions like, how long do you sleep? Do you wake up a lot in the middle of the night? Do you find yourself having to urinate? If someone has to urinate in the middle of the night, chances are good they're not reaching deep sleep. And they're not getting the typical patterns that slow the kidneys down at night. So that can be a clue. Has anyone heard you gasp or snort in the middle of the night? If that happens often, it could mean sleep apnea. It may be that the person is holding their breath for 30 seconds, as long as 30 seconds or more. That's a long time. And that gets the body into an alarm state, usually results in an awakening, whether the person remembers or not. And so that's important too, because people who get poor sleep tend to crave junk food. They crave more carbohydrates. They also are more inclined to become diabetic. and they have poorer mental states during the day. Their emotional states are more fragile.
Mm-hmm.
Yeah, they have more mood swings, etc. So I can throw antidepressants and mood stabilizers at someone all day, but if their sleep is not good and if they're eating junk food, I can't get them well. So I need to help them understand that.
Mm-hmm. Yeah. I definitely think I'm going to have an episode just all about sleep, because that is so vital on how to optimize that. So you mentioned mood swings there, and I did come across somewhere on the internet how you had mentioned how you had seen people who were having mood swings from sugar addiction, but they were actually being misdiagnosed as even having something as severe as bipolar disorder. Could you maybe just go a little bit deeper into mood swings and psychiatric disorders?
I'd be happy to. The way that well, first I'm going to start out by saying the Women's Health Initiative had a recent study where they found an association between a high glycemic index diet and depression. So they found that these postmenopausal women who had higher sugars and starches in their diets were more inclined toward depression. Now, association, we all know, is not cause and effect. But if you look at the way that these sugars behave in the body, it's most revealing, in my opinion. So I'll have patients who say, well, yes, I'm up and down all in the same day. I'm doing fine, and then suddenly I'm in tears. And I'll ask questions like, well, do you ever get shaky? Do you ever get headaches? Do you ever start feeling a little bit panicky? What happens during those low points? How do you feel after you eat? And sometimes I'll say, well, let's just get you a glucometer. And I want you to take your blood sugars an hour after a meal and 2 hours after a meal, and let's see what that curve looks like. For people, okay, without knowing what insulin's doing, we never get the whole story. But for people for whom that's revealed with just the glucose alone, it's pretty startling. Sometimes between an hour and 2 hours after the meal, they go into hypoglycemia. And that's when they start getting shaky and panicky, and they're also more prone to feel depressed. And what they need in that moment is to get something quickly to eat. And they'll often grab the nearest thing, a bagel, which is very high in these acellular carbohydrates, so will turn to sugar very quickly, could relieve them within, let's say, 20 minutes. A piece of candy, maybe even faster. So what I find more often is that these mood swings have to do with kind of a subclinical or clinical, in some cases, hypoglycemia. Not as severe as what you see in a type 1 diabetic, not life-threatening, but their sugars go down. I had one woman who kept going down in the 60s over and over again. She now has a very stable blood sugar, but she's on a low-carbohydrate, high-fat diet, and that has made the difference for her, both in terms of her mood and in terms of her health. And she's lost weight. So, which was a pleasant side effect for her because she had started to gain the middle belly weight that says that her metabolism has changed. Mm-hmm. So these are the sorts of things that I see in practice. Kids, it's really great because the kid will, the parents and the teachers complain of ADHD and they say this kid's not concentrating. I ask, when is it worse? Well, it's worst in the morning around 10 o'clock. 10 a.m., and that's usually the snack time for most schools. So I say, well, let's try a breakfast of bacon and eggs or muffin frittatas. I love muffin frittatas because you can bake them ahead of time. You can freeze them. You can set them out to thaw. Look up muffin frittata on Google. Those of you who are listening, it's great. It's really great, especially for busy families. So he's had his muffin frittatas and he's sitting in class and things are better. So the teacher calls me and says, could you give Johnny an extra dose of that medication he gets in the morning? And I said, what? Muffin frittatas? Bacon and eggs? right?
Oh, that's beautiful. Imagine that you phone the mum, look, the school said he's performing well. We need to up his dosage of eggs and bacon.
Exactly right. Oh, I actually read, it was really funny on this newsline. It said, and health conscious parents are doing puzzling things like giving their children sausage and eggs in the morning to try to sustain, their attention. And I'm thinking, it's because it works. It works. That's a very good strategy.
Yeah, that's an excellent tip. So yeah, these mood swings that from children that the teachers are seeing, or even adults are feeling, it's coming around again that their body is deprived of energy and they're looking for a quick fix. And then because they're going through the highs and the lows and the highs and the lows, these mood swings are seen as something that could have been another disorder, but it's just an addiction to sugar.
Yes, it's just and when people get to that low point, because these acellular carbohydrates act a lot like a drug, kind of when you're referring to addiction, it's very much like Xanax, which has a very short, what we call half-life. It stays in the body and in the bloodstream for a very short period of time, but it packs a punch during that time and leaves the person wanting more. And that is what these acellular carbohydrates, or these refined carbohydrates, these starches and sugars do. And so these people are on these really highs and lows, and they feel okay for a while until insulin takes this peak of sugar away from them and stores it as fat in the fat cells. And then so long as the insulin remains in the bloodstream, having been provoked by such a strong carbohydrate, it actually locks the fat in there. So with every peak, the person is also gaining weight. And the insulin that remains in the bloodstream is not allowing it to be released for fuel. So then they grab something more to eat, and they get another shove of insulin to save them from this high sugar peak. And then they go crashing down again, and that fuel gets locked in as fat. So they're gaining a little tiny bit of weight with each one of these excursions. And it's just causing all kinds of havoc with the metabolism.
Is that also what people like to sometimes call hangry, where they're hungry and they're angry?
Yeah, because they're irritable, or they feel like they're in despair, or they feel very sad. And in those low moments, it's like a kindling for anxiety and depression.
So it's fascinating. We can hopefully everyone can hear there's such a strong link between what someone's diet is every day and their mental state. But now I'm sure you must be an outlier in the psychiatric field. There's not many psychiatrists who would take such a keen interest in getting that nutritional foundation correct to make sure that they can work with the patient's brain better.
Well, I would say to the psychiatrists that are listening now, learn more about this, because I have found that in my practice, it has been a great source of satisfaction, job satisfaction, because it's funny. My niece worked in another clinic, and she came here to my clinic, and she started working with me in about 2011, I think. And she pulled me aside one day and she said, "These people are getting better." And I said, "Yes." And she goes, No, you don't understand. They're getting better. And I said, "Right."
And I guess that must be the case, but sometimes the stereotype might be, if you've ended up at the psychiatrist, you're a chronic condition and that's you for life. Yeah,
right. And actually, it is for life, in my opinion. However, changing the diet and getting those moods stabilized will help reduce, and in some cases eliminate, the need for medications. And that is really satisfying. Either way is fine with me. But reducing or eliminating the need for medications means that the patient is going to have fewer side effects.
Yeah.
and will probably not kindle as much mood problem. So it's a better life for them. Their quality of life goes up.
Mm-hmm. So I'm interested then also in, have you looked at ketones and brain health in any way? So
I have to some extent. I would not call myself an expert on that.
okay.
But it is intriguing to me that a lot of the medications that we use, that we call mood stabilizers in psychiatry, are actually anti-epileptic drugs.
Mm.
Very interesting. Yes?
Mm-hmm.
Well, ketosis and a ketogenic diet has been used since at least the 1920s to stabilize epileptics.
Yeah. So that whole pathway there of the anti-epileptic drugs and how ketones work on the same pathway. I actually, I haven't published it yet, but I've interviewed a charity here in the UK about using ketones to help stabilize epileptic children, and it's incredible just the power that these ketone bodies, this other fuel source, can have for healing the neurology.
Yes, well, University of Hawaii at Manoa was running a study in collaboration with the Shriners Hospital, I believe, of autistics, putting them on ketogenic diets. And there's a preliminary report that can be seen on YouTube, which is just a lovely little news report. And you can see that the parents are really motivated to keep it up, even though it seems like a hassle because there's a lot of preparation that you would normally have to do if you were just eating a processed food diet. And the researchers were reporting, not formally, not in a formal study, but on this little clip, they reported that they were seeing results within days, not weeks, not months, but within days. And what they saw is that these kids became more outwardly focused and more in tune with their environment instead of being so internalized. And it was remarkable. And so, and one of the parents said, I'm paraphrasing here, but she says, well, what's the worst that can happen? I prepared some food he didn't like and nothing came of it.
Mm-hmm.
That's the worst that could happen.
Yeah.
So I think what that points to is that this is an approach that is very low in side effects. Now, this is, I believe they are using more of a whole foods approach, whereas the ketogenic diet of the past was more of a medical foods approach. And there were all kinds of side effects from that we might not see with a whole foods approach. But again, these studies are in their infancy right now.
Mm-hmm. But it just proves again the power of, I've always tried to explain to people that the probably the biggest chronic chemical you're going to expose your body to every day is the food that you put in your mouth. So that is a chemical you have to ingest every single day, but you can decide what those chemicals are going to be. And exactly as these studies are showing how, you do a change and you can actually change your physiology within days to weeks and see the clinical results.
Yes.
Yeah. It's so empowering.
It is. I would say one caveat here, being a doctor, I'm very aware of this. Just going from what you're eating now to, say, a ketogenic diet or a low-carb diet could have some side effects that are unanticipated. And this is especially true for people who are, say, diabetic or have high blood pressure, because these diets tend to lower blood pressure and they also tend to lower blood sugars. And if you're on something already that lowers your blood sugar, say insulin, you could get a hypoglycemia that's dangerous, or you could get a low blood sugar that's dangerous. So I would encourage anyone who's considering these diets that we're talking about here, that they make sure that they do it under medical supervision, particularly if they are taking medications. But that's really good news because that means that a lot of people can get off these medications. So I have a lot of hope for these approaches to diet, in addition to the mental, there's the physical. And really, so far in history, we've not been able to totally separate the brain from the body. So,
so we've touched on then the importance of nutrition for our brain, how people can experience massive mood swings and what appears like psychiatric disorders just because they're not actually feeding their body well. So your particular approach then is to do real food approach, and it sounds like to put a person on a sort of a tiered lower carb type diet to take out the refined sugars. Is that a good sort of idea of what you like as your sort of dietary prescription?
That's what I do. I like to lay the groundwork, though, by extending the overnight fast. I think extending the overnight fast, especially for people who have accumulated belly weight, is a good idea. And the way I do this is just simply to have a ketogenic breakfast, but start introducing carbs at lunchtime. And so I'll say, okay, go ahead and have a toast-free, orange juice-free, fruit-free breakfast. Have something like a couple of these muffin frittatas, which I keep talking about. They are so good.
I can see you're a massive fan of them. I wish I could post one through the screen to you.
I'm such a fan. I wish I could just feed everybody one. Just give them a little sample. They're so good because you can put bacon in them. If you're a broccoli fan, you can put broccoli. I mean, there's so many ways you can make it. You can use your creativity. Enjoy. Make a happy face on it.
I'll link to a recipe of these in the show notes for people.
That'll be super. And so that kind of extends that fast overnight because they're not getting the carbohydrates that are going to provoke insulin. And if they have gone into ketosis overnight, it's not going to disturb that. And I find that a lot of my patients, even if they just go that far, they tell me that they have better mental energy. So, and some of them do actually lose weight. And I say, watch your clock, your watch, and see how long it takes before you're hungry again. I don't encourage people to go like to 3 p.m. And the reason being that if they've not trained their bodies to be fat burners, then they're going to be looking for carbs and they may be out of fuel and they could, quote, hit the wall, close quote. So I haven't introduced maybe some fruit or something at lunch. But by doing that, I lay the groundwork so that if somebody wants to go keto, then all they have to do is go to their lunch and then eventually to their dinner, and then they're done pretty much. And they've done it without hitting the wall, so to speak, where they've run out of fuel. Mm-hmm. So it's a gradual approach, but considering that what we're trying to do here is change a lifetime of habits in people who are already fragile, I really don't want to pressure them too much. I want them to be able to go at their own pace and also feel it. I want them to feel it. I want them to experience what it's like to feel clear-headed and to feel calm and to feel like the blood sugars are under control during the day. A woman that had the hypoglycemia, her blood sugar went down in the 60s after her meals. She discovered this with her glucometer, and she ended up doing a low-carb diet, and basically she became psychiatrically well and metabolically well. And that was like fantastic. It was really fantastic. She was one of these people who could actually come off meds and it would not be a problem. So,
So it sounds like would it be a good assumption? Well, what's the word I'm looking for? Not assumption, maybe, but that psychiatric health is tightly linked to energy, how our body is managing its own energy. So a body that is managing its own energy very efficiently tends to have better psychiatric control too.
I believe that. Yeah, I think that when people don't go from normal energy to low several times a day, they're less stressed. And they're not hungry. That's the other thing. When I ask them to look at their watch to see, when are they hungry again, they're really not hungry and they're surprised by that. And they're not thinking about their next meal. that becomes obsessive. I remember those obsessive days for myself. I remember when all I could think about is the next meal and what can I get away with eating without getting fat. That was, for women, especially for women, this is like, not that it's not bad for men, but I'm just saying women are usually a little more body conscious, more conscious about how they look in a dress. And so for us to be constantly thinking about the next meal and what it's going to do to us, wow.
I guess with you, I had a keto nutritionist, you may know Emily McGuire. And,
yes.
And we brought up, it's something I hadn't even really considered because I'm a male, but that issue of, with the anorexia, the bulimia, the eating disorders, and that's something that kind of patient would walk into your clinic. And even we were talking about that control factor when it comes to food. So,
yes. And control over the body. So, so I have women who have lost weight and then they gain it. And then they lose it again, and then they gain it, and then they lose it again, and then they're a little better able to keep it off. But here's the deal. Here's the thing that they got psychiatrically that was the gift of being able to do this, even though it sounds like yo-yoing. They now know where the gas is and where the brakes are for weight gain. They know, and they know they have control over it. They know exactly what did it. And they don't have to guess about it anymore. And that is a gift. In fact, I have to say, I'm really looking forward to the Apple Watch with the continuous glucose monitor on it. There already is one through Dexcom, but it's invasive. Tim Cook just took one that is non-invasive for a test drive. I understand he wore it for 3 weeks. He's the CEO of Apple, I understand. And he says it changed the way he eats. And I think seeing in real time, just seeing right here in real time, what is happening to your body and how your body is processing sugars, because we really are different from one another in this respect overall, will help us better understand what we can eat and what we can't. And I think it's going to blow this wide open. And I think people are going to feel better and will start knowing how to step on the gas and how to apply the brakes. And we will feel more in control. I think it'll be a wonderful thing. My understanding is he's not going to make it a medical device. My understanding is not going to look for that kind of approval. Instead, he's going to make it available for the general public.
I think I always see that the legal term is like educational or entertainment only, so something like that. But I think I agree, because that's, again, comes back to that term of biohacking and knowing your own physiology and actually being able to go, right, so I just ate something. Did my body like that or not like that? And I can actually, my new cool trendy Apple Watch or device actually teaches me that. So because it's an Apple product, that's the message is going to go much wider, much faster than other ways of doing it. So I think it is a good.
I think the Silicon Valley is going to lead the way. I think they're going to figure it out. I remember walking into a Palo Alto startup and seeing all these young people eating like goldfish crackers, and I thought, I think this is going to change soon. They're going to develop the technology that's going to tell them this is not a good idea. And they're going to change the way they eat. And sure enough, it's happening, and I'm so excited. I've got to interview recently another Silicon Valley entrepreneur. It's something I want to talk maybe a little bit about, Nootropics, and it is incredible. I can see it that group of people out there are hungry to feel good and to perform well, and so they're trying to find any little nook and cranny to be able to do that. And fasting and a ketogenic diet or a lower carb diet is definitely, they're finding that, like, we've, in Silicon Valley, we're performing better when we do those things. Yes, that's absolutely true. And a lot of these people in these startups really are kind of running intellectual marathons daily.
Yeah, they've got massive pressure on them.
They do. And so to be able to do this and do it more handily than they've been able to in the past is great. One caveat I would say about the Apple Watch, while I have great hope for it, it does not tell us what insulin's doing. And I don't know if you heard of Joseph Kraft. Joseph Kraft. He basically did oral glucose tolerance test with insulin, where he starts out with a beginning insulin and a beginning glucose, and then you take your 75 grams of glucose from Lucozade or whatever the sweet drink is that you take in the lab, and then they keep checking your blood sugar and your insulin every hour. And his were 5-hour tests, so they were pretty exhaustive. And he generated some graphs that were very interesting. And one of the things he found is that in some people, the rise in glucose and the rise in insulin happen simultaneously. But in some people, like the woman I told you about who is getting hypoglycemic, her insulin was actually overshooting her glucose. And you can't see that on a glucometer, and you can't see that on an Apple Watch. And so you may look at your watch and say, oh, I have a normal glucose. But unless you know how much insulin you produce to keep that normal glucose, then you don't know if you really have metabolic syndrome or insulin resistance. And I think that can be misleading. But I think having something like that is better than not having something like that.
Yes.
And getting the information is much better than not getting the information. But I would recommend that most people who suspect that they have insulin resistance get a 3-hour oral glucose tolerance test. If you want to write this down, it's OGTT in America. We call it OGTT with insulin. And I think that generating that graph will give you the information that you need to know about your metabolism.
Mm-hmm. That's empowering. I'll link to that so people have awareness. So I'd like to get now a little bit deeper into, with the time that we got left, about optimizing our brains, if you wouldn't mind. I mentioned the word earlier, nootropics. Are you familiar with that? And do you have any sort of opinion from a psychiatric point of view?
I have just a glancing familiarity with nootropics. So as far as taking something out of a bottle to help your brain, trust me, I have done that. I have grabbed this and grabbed that. Does this work? Does that work? And it's always an N=1 experiment. And I would say probably the one that I found helped me the most was, I would say, a couple of things. One would be fish oil. And then the other was making sure that I had a methylated B12. That seemed to help me. But I think I was low on B12. I may have been getting analog B12, which shows up on a test. The active B12 that human beings do well with, and the analogs that are sort of the synthetic Bs that we see a lot in pharmaceuticals, still show up as B12 on a blood test. So you can be active B12 low and still have what looks like a normal B12 or even a high B12. So what I do in my practice is I get a homocysteine, because homocysteine doesn't lie, and it reflects active B12, active B6, and folate. So that way I can tell if somebody's low. So I would say B12, but you have to make sure it's an active form. Or just make sure that you get plenty of meat, fish, eggs, and poultry. So that's one thing I think a lot of people are low on, and they may not know it.
Well, sorry, just to jump in there, because so many people take B12 injections to improve their energy levels. So I think that's where people can relate here with B12, and they may go to their GP and say, oh, I feel fatigued. And then they go, oh, you're low in B12, and they give them a jab in the bum every 3 months. Yeah, and that seems to work. In my practice, when I've talked to practitioners about giving my patients injections, my experience is it's hard to get, and we don't give the injections here. People who take Prilosec or some of these proton pump inhibitors,
that are meant to keep them from having acid reflux or heartburn.
Mm-hmm.
They need to take B12. People who take metformin, they need to take B12. And I usually recommend methylated B12.
Okay.
I think most people do pretty well with that. So B12 is, I guess you could call it a nootropic.
Yeah, it is.
Fish oil really helped me. I mean, I could probably type 15 words a minute on a good day with the wind behind me until I started taking fish oil. And about 3 months later, even the kids I was treating were going, Dr. Childers, your typing is so much better. I mean, it must have been horrible. It must have been hot and peck, single finger. So,
I can imagine these tech-savvy kids watching you type very slowly and thinking, oh, can I type for you maybe?
I know, right? These kids are like in residential psychiatric treatment, but they were brilliant. They were so much fun. But
so
anyway,
how much fish oil were you taking then to get that sort of clinical benefit?
Well, I wasn't taking a lot. I was just taking, I had read 2,000 milligrams. I've since read from the American Psychiatric Association in 2006. They put out a paper saying that they thought it would be wise to take enough fish oil such that DHA plus EPA equals 1,000 milligrams. So you just look at the back of the bottle and you add up the EPA and DHA and you try to get somewhere between 900 to 1,100 milligrams. And I think you're golden at that point. And that's about what I take right now. And I find it works very well. My typing is very, very nice. Thank you.
Yeah, and I think that's such a nice side effect to have. Well, a positive effect to go. A lot of people are told take fish oils because it's good for your brain and for your eyes. And
yes.
Yeah, and you saw it in your typing speed.
Yeah, it's eye-hand coordination became very good in ways that it hadn't been when I was a teenager.
Oh, fantastic. So what other brain biohacking tips could you share? Any other tips that you have for the listeners?
Well, I think it's interesting to me that coconut oil may be able to, at least the MCT, the medium chain triglyceride type oil from the coconut, is able to promote ketones in the brain without being on a ketogenic diet. And I thought that Mary Newport, who's an MD whose husband had Alzheimer's, gave us a nice description of how well that helped him. She, however, didn't give the MCT oil. She just gave the coconut oil, and she gave it 2 tablespoons a day, and it made a tremendous difference. I think that in non-APOE4 dementia, it seems to work better, and I can't explain why. I did see one study where they thought a ketogenic diet helped people who had, say, APOE3, but who had some kind of dementia, but actually may have interfered with verbal ability and verbal memory in people with APOE4. So I'm cautious to recommend that as a broad stroke for all kinds of Alzheimer's. But I am intrigued by it. And I do take my coconut oil, hoping that it will extend my shelf life as a psychiatrist.
Uh-huh.
So, and I can't say that that's doing it, but so far so good. I'm still practicing. So
fantastic. So yeah, so it sounds like something simple so far is methylated form of B12 and a good source of fat to try raise your ketones potentially to help your brain. And the fish oil to help your brain. Those are some good things, and of course, sleep is one of the bigger ones, just to optimize your sleep. Which maybe we'll have to get you back on again to talk about sleep at some stage.
I would love that.
Fantastic. So, Dr. Childers, how would people be able to get in contact with you or follow you more? Because I know you even gave a talk recently on that Jimmy Moore's low carb cruise, didn't you?
I did.
Yeah. Mm-hmm. So hopefully, I don't know if Jimmy releases those videos at all those interviews that people could maybe get to find out more about your talks.
I think he does. Yeah, you can keep checking on his low carb cruise line. By the way, he's already announced for 2018 that we're going to the tropics. So welcome aboard, everybody. Come on in. Let's all do this, right? And just think of all the vitamin D you can get. So, I mean, really, it'll be a very healthy cruise and a lot of fun, a lot of good camaraderie and karaoke. Anybody who's into karaoke, please, absolutely come join us. We need help. Anyway, so there's a plug for the low carb cruise in May of 2000.
And it sounds like you're a definite go.
I'm a definite. Oh yeah, I'm definitely a participant, and I did give a talk there. People can reach me at Ann Childers MD on Twitter, Ann Childers MD, and then I am on Facebook, and you can also reach us at Life Balance N as in Nancy W, lifebalancenw.com. That is our official site. And I look forward to being in communication. I really enjoy engagement and questions, and I welcome people's comments.
And again, for anyone listening, I'm going to be linking to all of these links on the episode page for this episode. So the links will all be there to click and start following you and make contact if they wish. So, and again, thank you so much for coming on. I felt you've really highlighted some very important points for psychiatric care and nutrition. And I just want to say thank you so much for doing that.
Thank you so much for inviting me, Gary. I hope you have a great day.
You too.